Guests on Keel heard via the Jack Spring Electric Keel Newsmaker Hotline. United States Senator Bill Cassidy is here. Hey, Dr. Bill, welcome back to Keel. How you been? How you getting along?
Hey, good morning. I kept on thinking of our last time when your partner said she wanted to go to Buc-ee's in Texas, and she was mad they closed the border.
Hey, guess what? I did a COVID-19 test Monday, got the results back early today, and I'm negative, so I'm not going to pass it on to you this morning.
No, that's great. That's great. Now, more importantly, you're not going to pass it on to Robert.
Let's start with we're way more than 6 feet apart, not only career-wise, but physically. Let's start talking to Dr. Bill this morning. Where are we, in your mind, as a physician? Where is America right now? And are we close to getting back to work? Are we over the hump, so to speak?
Well, I think of it like a wave crashing. Now, the peak of the wave may have hit the beach, but it's going to continue to run up for a while. And so the number of deaths is declining daily. The number of deaths in Louisiana and southeast Louisiana has decreased, but it's still kind of bumping up in other areas of the state. Since southeast is the most populous, that's going to be the worst impact, but still it's still bumping up. People need to be careful. When it begins to tail, hopefully we can end this shelter in place, get back to work, get back to life.
There has been talk on Capitol Hill of a second stimulus. Help me out with that.
I'm waiting on the first one so far.
How settle down, it's coming. How long can the federal government keep printing money? How long can this go on?
Well, a couple things. It really depends on how quickly we get out of this. So if we get out of it quickly, the next program will probably be an infrastructure program. I was speaking about that about 3 or 4 weeks ago. Now the president's speaking about it. We got Democrats speaking about it. The federal government can borrow money at 0% interest rate right now. And now think about that, 0% interest rate. So what a great time to say, okay, let's get construction going because it puts a lot of Americans back to work. And construction, of course, pulls through manufacturing, so that gets manufacturing to work. And manufacturing and construction is going to stimulate the oil and gas industry and the service industry. And so that would be a way to get people back to work. And by the way, address a lot of structural inefficiencies in our economy so things are better off 20 years from now. Think I-49 North, I-49 South being completed so that we could just whisk with I-64, I-14, all these projects in Louisiana that have just kind of been waiting can be done. Now, and putting Americans back to work. That would be the program I would like to see. Again, if you can borrow money at 0% interest rate, this would be when you'd want to take advantage of it.
When you are part Dr. Bill and part Senator Bill, and you talk about putting Americans back to work, weighing one of your professions against the other, do you have a date in mind? Do you see, do you peer into your crystal ball here?
So a couple things. One, you got to make sure that people continue to shelter in place and the number of deaths goes down. The number of new cases is decreasing. Deaths will lag, but even deaths have gone down. That's number one. Number two, you got to have widespread testing. If I know somebody's at risk, then if I'm the person at risk or I'm the employer, you got to take precautions. If somebody's not at risk, they can live more freely. Think for the person who's diabetic and hypertensive will need to wear a mask and stay 6 feet from coworkers wherever she or he works. The person who maybe has antibodies suggesting that they're immune, they're 22 years old, they're otherwise healthy, they're at really low risk of having a problem, they can face the public. And so we need to have that kind of approach where we understand an individual's risk and use that information by which to create work rules to protect them.
I want to ask you about the immunity registries, because there's a lot of debate over this. If I had coronavirus, I would then have to carry a paper? Is that what that does?
No, and actually there shouldn't be debate because it's no different than vaccinations. When children get vaccinated, those vaccine records are put into an online database or registry. It's been in place for 2.5 decades now. So when the child is vaccinated within a week of birth and then joins the Air Force 25 years later, the doctor just goes to an online portal, pulls down the record of immunity, boom. We don't have to revaccinate you because you were vaccinated within a week of your birth. That's now. That's the way we do it. We live with it. There's privacy laws. It works. So if we know that somebody is immune, then we can put it in the exact same immunization registry, so that when they go to work and the guy says, well, I got to know whether to put you in the back room 6 feet separated from people or whether you can be at the front desk saying hello to folks. I need to know if you're immune or not. Well, boom, I've already had a test. And here's my test, and it shows that I am immune, so you can put me wherever you want to.
Dr. Bill, pardon me, you're talking about registering 300 million people in the United States and having to have a government imprimatur to get a job or to go to a restaurant. What am I missing here? That doesn't strike me as a great idea.
No. You don't have to have a government imprimatur. Not at all. This is all voluntary. You've got the flu vaccine. Do people know that you've got the flu vaccine? No, they don't know you have the flu vaccine. Your employer may, because employers do have the right to know, what is the health risk of this person versus that person. That's well established. Teachers, for example, oftentimes need to be vaccinated so that they don't get infected from children who may get the measles despite themselves having been vaccinated. We do that in our society. And we live with it, and the reason that nobody knows about it is because it is not a problem at all. We have laws that protect workers, laws that protect privacy. We've lived with it for 2.5 decades, and it's worked very well. Let's just use that same system. I can go to a restaurant, but frankly, if I have diabetes and hypertension, I want to know that I'm at risk.
But wouldn't there be some sort of
to know that I'm at risk?
Wouldn't there be? And I'm sort of maybe I'm inferring too much here, but it sounds like there could be potential penalties or loss of employment or something punitive if you're not registered. You say registration would be voluntary, but on the other hand, there would be limitations or at least potential limitations in your life. Am I wrong?
So the wonderful thing about this is we've been living with these laws for 2.5 decades, and so we've got it all worked out. The Equal Employment Opportunity Commission put out a ruling or a guidance about 2 weeks ago, and they say this is like everything else. You cannot condition an offer of an employment based upon whether or not somebody is immune for COVID-19. But once you've employed them, you can ask them for that information, because that way, if they need to be protected, you need to protect them. And if they don't need the same protection, you can put them someplace where they don't need the same protection. I mean, we got to flip this. Keep asking yourself, one, what do? Just keep writing checks? No, we don't keep writing checks. We figure out how to get out of it. How do we get out of it? We figure out who needs to be protected and who's otherwise pretty well off.
But we're also
and
dealing
with
with
that information.
But we're also dealing with an illness, with a virus that 50% of the people who have it, they're asymptomatic and they would never know. So how does that work?
So there will have to be widespread testing, so 310 million Americans. Ideally, 310 million Americans. We know whether or not they're at risk or not, and then that's going to involve testing people. Now, some people that already we know are at low risk. Think somebody who's less than 25. If they're otherwise healthy, no obesity, no diabetes, no high blood pressure, then they are at low risk of having problems. They can probably go back to school, frankly. They're paying a high price right now, even though they're at low risk of having a problem. They're missing school, they're missing work, they're missing college, they're missing athletic events, professional development, you name it. The people who are less than 25 to 30 are paying a price to keep the rest of us safe. Now, we could check folks, let them go back to school, check them on a regular basis, and if they're immune, let them know they're immune, but continue to follow until we know that they are. By the way, the Germans have just started doing this, letting school children go back to school, knowing that they're at such low risk of having complications, but continuing to follow them and so they can watch them until they become immune.
Senator Cassidy, the numbers show quite a disparity in the by race. Is that shining a light on something that has been a problem in our nation and we need to address it? How are you feeling about that when you see those numbers?
Of course you don't like it, but let me say, if you look at what is a risk factor for having a bad coronavirus infection, it is obesity, diabetes, and hypertension. Now, African Americans are 60% more likely to have diabetes. I think 50% more likely to have hypertension. I'm saying that off the top of my head. And since diabetes and hypertension are related to obesity, again, more likely to have obesity. And so it may be that if you just say, wait a second, let's take all the diabetics and all the people with high blood pressure and all the people who are obese and look at them, there won't be a racial difference. But it's still a problem. We in Louisiana are 49th in the nation in terms of, 49th in the bad way in terms of having obesity, diabetes, and hypertension. And it leads to a lot of things like kidney failure, strokes, and heart disease, not just risk for coronavirus infection. So if this is a wake-up call to our society that we need to address this issue, and no matter your race, then that would be a good thing. And by the way, since African Americans have a higher incidence of it, it places them at increased risk for lots of diseases, stroke, kidney failure, heart disease, et cetera. Wouldn't it be great if we could address that there too and particularly benefit folks like that?